Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our first conversation for this morning as we refocus on COVID-19, what the latest science is saying, what we know more about. And here to tell us, or to join us in this conversation, we have internist and intensivist, Dr. Fernando Cuellar from Belize Medical Associates. Good morning.
Good morning, Doc.
Good morning, guys. Good morning.
All right, Dr. Cuellar. So, we keep on having these refresher courses with you, I'd say, as we try to stay up to date with the latest information coming out about COVID. I want to start off by talking about one of the recent developments as early as this weekend, talking about possible transmission, airborne transmission, that is. And it was a really interesting, of course, it's happening in the United States with the CDC. But tell me what the science is saying so far as to what we know that is new when it comes to transmission.
Yeah, Marlene, that's a good point to springboard off, to jump off, because over the weekend we saw on Friday the CDC, which is in our minds, in our medical minds, and we have always regarded CDC as the pinnacle of information, the pinnacle of science, no? Mm-hmm. The top of the mountain, and we almost want to bow down to the leaders of the CDC and guys like Fauci and so on. Pretty much, they were next to gods, no? When they say that's so.
Yeah. Mm-hmm.
But unfortunately, we've seen a couple of missteps where they've put out wrong information or perceived to be wrong information. Then you get suspicious that it's not just the science being talked about, but politics and science, where the government of the US does not want certain information to get out in certain ways. We get suspicious.
Yeah.
So Friday we saw that they said, you know what, this thing could be transferred not just by droplets, but aerosol, meaning that if you talk or you're in a room and you sneeze and you come out and the virus can still be suspended in the air, small particles, mm-hmm. smallest one, and somebody come in the room and could get infected, then that was even more alarming, no? Mm-hmm. And then last night, Monday night, we saw the reversal of that, where they take that and say, oops, sorry, that may be a mistake. We never mean to say that. And we go back to the original thing, which has pretty much been the standard thinking of everybody throughout the world, that it's just in particle forms, meaning that if you sneeze and somebody there close to your that's why the 6 foot mm-hmm. top arrangements is being discussed, that you only could get it if you're in a close proximity, and that's why the mask is so helpful.
Yeah.
So that was confusing, but I think we go back to the standard thinking of those throughout the world, that we only get it through small particles, meaning that if you talk or cough or sneeze and have a mask, or the other person don't have a mask, it's highly contagious. No?
Let me ask you this, Doc, from a scientific and a medical perspective, perhaps. The scientific community is looking at this situation, the whole coronavirus, and the fact that it is something that is fairly new to them in terms of this particular strain, so to speak. Where the CDC is concerned, do you believe that perhaps they should have erred on the side of caution and ensure, first of all, that in fact this thing cannot be spread in an airborne fashion, as opposed to coming forward and saying, well, look, it can remain suspended in the air based on, as you described it, someone sneezing in the room, for instance, only to come back and retract that? The question is, we're dealing with a fluid situation where there are new developments every day insofar as the research that is being done on coronavirus. Should they have erred on the side of caution, or is it okay for them to say one thing, come back and get the scientific proof and remove it off the table?
Yeah, I think the back and forth causes more problem than it hurts more than helps. Not that it creates confusion, we're not sure. And indeed, everything that you do, you better err on the side of caution and just tell people that, hey, we're not 100% sure of how this virus behave, but we know that for a fact that if you use your mask, if you practice social distance, that will reduce the spread of the virus as much as humanly possible.
Yeah.
And as the time goes by, when we learn more about the virus, then we have come out with more information. But it was highly irresponsible of them to be doing this back and forth thing,
Yeah.
And
It's unfortunate.
Who me for criticize the CDC,
Yeah.
But we've seen the behavior of them. We have seen the behavior of them over the past month, where they've had some not so good PR and good information put forward.
Yeah.
But that brings us in Belize. I think that that we here in Belize and the government and the ministry and everybody, and I have said this many times, we should behave, we should think, we should be doing things like everybody that believes got a virus. We don't have no clusters, and we don't have no fancy talk like community spread and blah blah blah. Everybody that believes have the virus until proved otherwise.
Yeah.
So that's why it's important that we use the mask properly. We practice our 6 foot and do all that hand washing and all the simple things that will make a big difference. And that has to be the message from here to another year at least, that listen, we have to do that, because said it also is that the virus will dictate the cheese, the virus, when we have more virus, we have less cheese being money. That is always the next big part of governments and countries' dilemma about the economy.
When we look at, and I appreciate what you're saying, and I think to just wrap up the previous point, I think the worry is that it adds to the skepticism that people have had with some of the scientific data that has been released. But at least locally, we have been hearing from our health officials that for some reason, there are still people who are not adhering or recognizing the ease of transmission. You talk about gathering in crowds. Closed spaces is also identified as a risk area, and not keeping that level of social distance. Also, that the person most likely to give you is probably your coworker or your close friend and family. How do you put that into perspective? I know you're someone, when you're with your patients, it's all real talk. How do you help people to understand that the people you trust the most may be the ones that bring you the most risk?
Yeah, that's a very good point, Marlene. It's unbelievable that people still not act responsibly, that they still feel like they have to the party. And I want to tell them plain, as hard as it sounds, I am a biggest party animal, big time, where me always need for them out, they pace up, they hang out. But we don't need to do that right now, man. 1 year of chilling and behaving yourself and keep, home. And stay locked up and just you could chill out with a couple of good friends and close families, and not have to them out and got all of these parties and hangouts and so forth. Yeah. So I would want us to all get together, figure out how we could best message this across to the regular person, to the regular Belize, and have it in different. I don't know if talking to somebody from PG different, for talking to somebody from the south side, for talking to somebody from north, but do it in a way that we think, or we would hope that the message gets across easily, because that's the biggest thing that we have to overcome, that people understand. Thank God that Belize, we're smarter than one lot of Americans, for example, when they talk nonsense about fake news and this hoax and virus that just make up thing. We're not there, thank God. We just need to behave ourselves a little bit
But
better.
Doc, if I may interject here, right? I think personally it becomes increasingly difficult or increasingly challenging for us to be able to break what we would consider cultural norms in terms of our practices and stuff like that. You're suggesting, and I take it fully, that perhaps we need to remain at home and to kind of stay away from some of the practices that we've been known to do, the partying and what have you. But those are the social aspects of who we are as Belizeans. So while in the face of the virus, yes, you're telling us, well, we're better off remaining at home. That's sound advice, but how do we break that from a mental point of view? That is the question.
Yeah, that's the million-dollar question, Isani, and very good question. I don't have the answer to that. We probably need to recruit other people and maybe get our soca artists to do it and the priests to say it, and God knows who else to say it in a way that people can understand that. Listen, we know they ask you for not to be Belizean, we just ask you for be one responsible Belizean for one period of time.
Yeah.
And when I say 1 month, neither when I say 1 year, so that we need to give up September celebrations and partying and 19th of November, Christmas and all of these things that we are known to celebrate a lot, no?
Yeah.
And be responsible, guys. I mean, this is a long weekend, for example, and I know people may bored and want to go out and deb out and go to Chetomal and go there and don't you, but we must could figure one responsible way of doing it, man.
Yeah.
We're smarter than this.
There was a concern from the Director of Health Services going into the weekend, considering the fact that indeed, ordinarily it would have been a festive one, but that perhaps there would still have been certain events at the household level where we're still looking at the potential to have another round of infection, so to speak, that would be manifested later in October, for instance. So the ministry was on somewhat of a high alert to look out for these kinds of scenarios.
Yeah, I think it's a very valid fear for the ministry ahead. It makes sense that people want to get together over the weekend. I was really impressed of looking at the Belikin Bash that was done virtually. I mean, I didn't believe that the quality of production of entertainment was like that, but we are there. And the COVID has forced us to see these things.
Precisely.
Yeah.
Remember now, the exposure of this weekend won't show up until the next 2 weeks. So
That's right.
we don't expect that one big case increase will happen today or tomorrow.
Yeah.
But we look forward for in the next 2 weeks, we can see more cases.
Yeah.
If indeed people never behave themselves and do things irresponsibly, no?
You know, it's if I could ask another question here in looking at the spread of COVID-19. You know, it's particularly insidious because asymptomatic people, the very healthy looking people, may be spreading the virus and you don't know. And I think that that's one of the things that we keep on hearing as a message. Can you explain to us, because there's a difference between having mild symptoms and asymptomatic. Oftentimes we get reports of a death that is confirmed to be a COVID-19 death after the fact. But in fact, when you look at the history, they did have some symptoms. Is it that the symptoms, the mild symptoms of COVID-19 are the type of things that we feel that we easily dismiss?
Yeah, indeed, Marlene. I mean, we can have people who have zero symptoms where you ask them and you interrogate them like you're the Gestapo and you tell them you're sure you never feel bad, you never feel tired, you never gonna eat a headache. And they would say, no, doc, I really never feel no way different than how I always feel. And that's true, that they could indeed not have no symptoms at all, especially if they were healthy individuals. And when you test them, they're indeed infected with the virus. And then you have those who have one mild symptoms where they dismiss it as, I just really work too hard, I got a headache and body ache, and I'm gonna sleep good and wake up next morning and I feel good. That's why I never feel like I had any trouble. So that is why indeed we have to send the message loud and clear that everybody that believes, me, you, Marlene, Isani, Dean Barrow, Johnny Briseño, everybody have the virus until proven otherwise.
So let's talk about these mild symptoms that we may be feeling and dismissing. Fatigue is one of them. I mean, I could go home today and just feel tired and say, oh, well, you know, maybe I had a long day. Is there anything you can say to us as to how to properly gauge these mild symptoms? Maybe it's allergies. Tomorrow I can wake up, you know, sneezy or stuffy. Is there any way to help us distinguish, or should we just err on the side of caution as much as possible?
Yeah, very good question, Marlene, because I see that very often that people say, hey, I feel tired today. I'm not sure why, but if it continues for a second and especially on third day, then you get suspicious that there might be something wrong. whatever mild or whatever non-consequential it is, feel like one knee headache, one knee body ache, one knee sore throat, one knee sneezing, one knee tiredness. And tiredness is one of the biggest things that people, hey, something, I don't got the same amount of energy like last week. So, I mean, you really have to pay attention to your body and get suspicious that it lasts 1 second and especially 1/3 day. I don't think that we need to get panicky if one day, today you're going to work and then by this evening you feel tired. Well, you may chill out the weekend, so maybe that would explain that. But no, go past 3 days and still think that just one rough day at the office or work. No?
Okay. Now let's talk about what we're seeing now in people who recover from COVID-19. This morning, I think the latest numbers that we're seeing, it's almost 1,000 people have recovered from COVID. We have just over 600 who are active cases at this time. So, I mean, there are more recovered cases than active cases. So let's talk about what recovery looks like for people with COVID-19.
Well, the technical definition of recovery is that when you have 2 PCRs that come back negative, no?
Yeah.
Say, for example, you got somebody where have tested positive, either with 0 symptoms, mild or severe symptoms. They would follow them up over a period of 2 weeks and do testing. And once where you have 2 consecutive PCR testing, some would say 5 days apart, some would say 7 days apart. And once those 2 are negative, then you go into the classification of quote unquote recover. However, and this is where the big but stand, that people who have had COVID still complain of different types of symptoms. That same tiredness, we know, not from our numbers, because we don't have studies like that, but in other parts of the world, people who had COVID back in March or February and are being followed for 6 months, they still complain that, hey, I still don't feel like I recovered fully yet. I still feel tired. I still feel broke up. I have some unexplained symptoms. We know for a fact that the COVID virus could affect long-term your heart, your lungs, your kidneys, your brains. So definitely, because of a new virus, we still don't have all the information, what it looks like in somebody who has had COVID 6 months after or 8 months after, or 12 months after for that matter. But we are highly suspicious that indeed the COVID virus could leave some long-term effect. And one I see them at the office, people who have had COVID earlier, still they have little heart issues, tiredness, shortness of breath. And when you do the examination, when you do all of them blood tests, it looks fine on the surface, but they're still not completely recovered. And that's not only in Belize, no, that's affecting us worldwide. That as we go along, we're gathering information to see what this damage this virus has left on the human body. No?
Well, the lingering effects, as we would describe it, some would say go well beyond a 3-month period. Like I've been reading articles where you have persons who had initially diagnosed and had gone through the COVID experience, and it's been months later and they're still complaining. They're still complaining of side effects, so to speak.
We're seeing that right now, Imani. I think I've seen at least a handful of people who had the virus earlier in Belize and still feel like they have chest pains or palpitations or shortness of breath, little achiness over the body, and that issue of the fatigue, like the energy factory still not get turned on properly for make them have the energy that they were accustomed to before. So yes, indeed, and this brings up to another questions though. How long does immunity persist? How long, meaning that how much defense you make up after you get exposed, how long that will last for, how good that is, which would then suggest that you could or could not be reinfected with COVID. And the famous talk about the vaccines, no?
Yeah. Now, I definitely want to talk about possibilities of reinfection because that's a reality we have to start looking at here. But we're going to take a quick break, and when we come back, we'll tackle that topic. So please, stay tuned.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
If you're looking for low-cost television advertising, have we got a deal for you? Advertise on Channel 5's Daily Classifieds. Channel 5's Daily Classifieds is one of the most effective methods for introducing yourself and your business to the community. Use our Daily Classifieds to recruit employees, promote specials, promote your products or services, promote a business opportunity, increase traffic to your website, and advertise items you have for sale. Let us help you save valuable time and money. Call us today at 223-0146 or visit us at our offices on Pony Drive to discuss how we can help your business grow affordably. Channel 5's Daily Classifieds. Advertise today.
For over 20 years, Great Belize Television, Channel 5, has been the leader in award-winning local programming. We have also produced some of the best video commercials, documentaries, and live events for clients countrywide. And we continue to offer high-quality production services to maximize your advertising needs for your business or organization. From concept to completion, let us help you achieve your marketing goal by producing your commercial, documentary, graphic animation, live event, or even designing your website. Using state-of-the-art equipment and experienced personnel, we can make your ideas come alive. For more information, come see us on Coney Drive or give us a call at 223-0146 or 223-7781 or email us at gbtv@dtl.net. Great Belize Productions, making great television in Belize.
And welcome back. If you are just joining us, we have been discussing with Dr. Fernando Cuellar the COVID-19 and the recovery of persons who have tested positive and who have gone through the ordeal. One of the questions that I have for you at this point, Doc, is the reinfection or the potential for persons who have tested positive for COVID before being in a situation where they contract the virus once again. First of all, what is the science teaching us at this point?
Well, unfortunately, we don't know. That's the bottom line. We are not quite sure that if somebody could get reinfected. Because our new virus, we've only been 8-9 months into this, and the data isn't there substantially to say with or without a doubt that somebody could get reinfected or not. We've had a couple of single cases, isolated cases, anecdotal reports that yes, people can be reinfected, but it's not a foregone conclusion yet that we can or cannot be reinfected. So definitely, we still have to have up our guards. We still have to be prepared that even the persons who had COVID still for practice all of the things then that we ask people to practice. That again, your mask, your social distance, and wash your hands and that kind of thing. So the straightforward answer to your question is that we don't know. We're not sure. And I've looked at all the different sources of literature from the US, from Europe, and it's still not able to give any concrete answer to that particular question. And that's one of the questions that's been asked worldwide by everybody. Can or cannot this happen again?
Yeah. So in that case, you still have to function as if you may be reinfected again.
Definitely.
Yeah.
And you got some other diseases where come to mind. If you can be reinfected, it might even be worse. Mm-hmm. For example, dengue. Dengue, we and dengue are a good friend here in Belize, and we know for a fact that you can be reinfected with the dengue virus, and then the second, the third episodes can even be worse than first episode. So we don't have to go too far and figure what or may not be the same for this virus. Yeah. The dengue virus behaves that you can be reinfected again with the virus, and be in more trouble next time. So please, those who are considered recovered should still go on like they haven't had the virus ever.
Yeah. Let's talk about home care management. So there are about 600 people plus who are currently at home, most likely, and trying to care for their own COVID-19. They've been given guidance by, of course, the Ministry of Health. But what do we know so far about how someone who has a mild case of COVID-19, what they can do to alleviate the symptoms and prevent the worsening to the point where they need to go to the hospital, be intubated, or end up in an ICU?
Yeah, I think the self-isolation as much as possible. No, everybody got mansions and big house, so stay in your own corner, but as much as possible, you try to do that, stay in your own room by yourself and coordinate for use the bathroom that you are. And I've had cases where, for example, the mother and two children or two teenagers would have. And it's difficult for them because there were big effort for that. You have to left the food at the door, and you have to coordinate the use of the bathroom, and the mommy have to there behind and just clean down the bathroom when a person use it. So it's quite tedious, quite a big effort, but that's what people need to do to self-isolate within their own homes, within their own dwelling, as much as possible. Apart from that, you need to have your temperature checked at least twice a day. We have some very, very user-friendly thermometers nowadays. We don't have to use the big time ones. We can use the same ones that we've been accustomed to. I have always suggested, but maybe there's no real practicality to have one pulse oximeter home. That's only thing where you put on your finger for check how much oxygen level you have. And that will be a good parameter for say if you're running into trouble or not, no? And then you could get simple things like you could get Tylenol home or something like Benadryl to help you with the milder symptoms. Tylenol, Benadryl, drink a lot of water, rest, try to maintain your mental health by, I don't know, watching TV, reading a book, FaceTiming with your peeps, FaceTiming with the other people, and because that part also is important. Now people really get into desperate, feeling anxious and desperate, but you have to do all of this to come out of it. And it's not just about yourself. No, you try to avoid infecting other people, both at home or at the hospitals or in a public area. No.
Let's go back a bit, Doc. You mentioned perhaps introducing in the household the use of the pulse oximeter. Okay, the question here is, how often would one need to do that? Would you wake up every day and administer this test, so to speak, to determine your oxygen levels?
Yeah, you would do it 3 or 4 times a day, Sani. You would wake up in the morning, check your oxygen levels, do it at midday, do it at the evening, do it before you go to sleep, and just get one pen and pencils and record it. It's a very user-friendly, it's a very simple thing to do. Yeah. The only thing with this pulse oximeter, it's expensive, no? Yeah. It's really expensive. It costs maybe $150 Belize. I would have hoped that maybe the Ministry of Health could get it in bulk and make it more affordable to people so that they could have at home. And it's perhaps one of the most valuable resources to tell somebody when they run into trouble. Mm-hmm. The fever, there's no parameter that you use to say if you're in trouble. You expect fever, you expect high fever, you expect fever for many days. But the oxygen level and the pulse oximeter would be something very valuable so that people not just wake up dead at home, no?
Mm-hmm. Yeah. Because that's something that can happen that you don't necessarily identify immediately. Your oxygen level can fall, and you won't know that it's in a danger zone.
Correct. We've seen a lot of cases where people not struggle for breathe, not they look like they have problems to breathe, don't feel like they have much difficulty breathing, but when you're testing oxygen level, it's below that 93 saturation that is considered the danger level, no?
Yeah.
And then that's the time to say, you know what, you call out in the house and say, please call the ambulance or please call somebody in authority to come because my oxygen level has fallen to 92 or 91. And that are the red flag where you say, not a need for go to the hospital. Instead of just wait until you struggle for breathing, you walk in an emergency room and you say, "See me, give me a tube and give me a ventilator." That will avoid many of that, no?
Yeah. Now, I'm curious because I know you keep up with the latest research. What has been some of the newest data that's come out that's really helped you to understand more about the pandemic or the disease itself?
The actual, as you know, my thing at the ICU, we've not had any major discoveries over the past 2 or 3 months. We still with the concepts of the steroids, how beneficial it is. The ivermectin is perhaps one of the newer ones that we've actually introduced into our protocol here in Belize. The ventilation or the high flow oxygen are used. We are always reminded to treat the COVID ICU patient as one ICU patient. So we need to make sure that the fluid levels, the urine production is fine. And there's a concept that I think still continues. I know about the proning that when you put somebody on their belly and treat them for a few hours, you know how typically you go in a hospital and you see everybody lie down on their back. In COVID patients, you'll get one lot of benefit for treat them lying down on their belly, which is called proning, no? And that is a challenge by itself. But to answer your questions again, in the ICU setting, we haven't had any major revelations over the past 3 months. And in the non-ICU setting with the moderate and mild cases, we still haven't had any major discoveries, no? The same questions we've asked today about immunity, and I think the biggest thing right now that the vaccines and so forth is being discussed big time, no?
Now, when you look at the severity of how COVID-19 can impact the body, we went from mild to some of the more serious ones. We've actually had people who have been able to go into the ICU, be treated, and are released. Does that mean that perhaps the medical officials are now more aware of how to treat and prevent the worsening of the disease?
Yes, Marlene, I think even in Belize, where we have relatively had small numbers of people in the ICU, people ventilated, we are learning more and more, no? Dr. Arriaga, who heads the ICU unit, myself, Hidalgo, other doctors, Bradley, Gomez, all of we are getting familiarized with treating the ICU cases. One of the biggest things we see, though, and this speaks volumes, is that patients who have other illnesses, diabetes, hypertension, obesity, heart disease, those are the ones who do poorly, no? Who tend not to make it, as opposed to the other person who have had no other medical issues. So this translates into those persons in the community who are hypertensive, who are diabetics, have to take care of themselves better. And people, especially young people, not only for think about themselves and say, you know what, be strong and healthy. I drink my rum like what my boy and say, what your name?
Sutherland,
they say I drink my rum, I drink my turmeric and whatever, and I strong. But it's not only about you, it's about your mother, your father, your uncle, your grandparents who have diabetes. And if you catch it and you carry it home, then you're even more guilty, no? That you did not do things the proper way. So it's not only about thinking about yourself, but thinking of those people who are vulnerable, who are older, who are have diabetes, who are obese, who have hypertension, who have lupus, who depend on chemotherapy, and those people who are termed more vulnerable. So those are the persons who do more poorly, and that's worldwide. That's not only in Belize.
And I think that, Dr. Manzanero has pointed out that one of the common risk factors for the severe cases they're seeing is obesity. And so that's one of the things that we do have to pay attention to. Now,
but Marlene, quickly, obesity are not just COVID, you talk about obesity and NCDs and how it links to cancer. So I think obesity, that was also another pandemic that has gone under the radar, and we not tackle it as much as we should. No?
Well, it has been within this decade classified as an actual chronic condition, which means you have to be able to do something about it. It can lead to cancer. It can lead to many different things. And now we're seeing with COVID how it's leading to some of the more serious complications. So, you know, your advice in terms of being preventative. Let's shift the conversation now. We were joking before you started that you have your own cocktail of vitamins and other things that you're taking to boost your immunity. Let's talk about.
Put me on the spot,
Of course I will, because you like to do it to us. So if we're talking about things like obesity, we should definitely be trying to curb our situation there. But also, what else can we be doing, ingesting or practicing to put ourselves on better footing if we do come in contact with the virus?
It goes back to the first thing is try to eat as healthy as possible. Definitely make sure that we're serving our fruits and vegetables. Stay away from the artificial, from the processed foods as much as possible. And as it relates to more specific thing, maybe one extra dose of vitamin C would be perhaps one of the biggest thing that I would suggest. Some zinc, some B complex, things that can. It's not proven, but there is some space for it that it does help to boost your immune system, no?
Yeah.
We were joking, like I said, I get one gallon a cocktail that was brought from me from Punta Gorda that the lady said that, hey, this one work, that this one make you not get the COVID, no?
Yeah.
I don't know what all you having, I trust her, but it does smell like you have one lot of onion and garlic. And to me, I take my shot glass of it every day and drink the glass of water behind. And I don't know if that just mental, I think it is, also mental reassurance that, but it doesn't hide away from the fact that I have to have, I'm sitting in my office right now, I have to have my chairs way to the end, not 6 feet apart. I have to have on the N95 mask. I have to have my face shield ready. I have to have like, to every 5 foot, one little bottle of hand sanitizer, and insist that everybody have on it. But so it doesn't replace that, no?
Yeah, I'm glad you said that, because no matter what we eat or how much we exercise or what kind of herbs we're taking, we still have to practice all the rest. Yeah. You know, one of the questions I had for you is, we talk a lot about masks and mask use and proper mask use, and there are lots of mask police out there as well. But if you were to look at it, what is the one thing we absolutely cannot forget? Is it looking at the mask, the distance, the hand washing? Are we focusing too much on one and not recognizing that the rest play an integral role?
No, Marlene, I think the mask are the major thing. I think more than, I mean, everything is important. Yeah. But to answer your question directly, I think the mask, and we brought up a good question, because just last night, we're having these CMEs, which are the sessions we have with the Ministry of Health, where we doctors get on Zoom and we have different presentations. And that was one of the things, for example, I made it clear that every healthcare worker should, once they're in the facility, should have on an N95 mask. Yeah. Every healthcare worker, and that means from the person who clean, to the X-ray, to the lab, to the doctor, to the nurse, to the administrative person working in the facility, should have an N95 mask. Okay, no a surgical mask, nothing else. But what I'm saying can translate into very much dollars, because an N95 mask, even if you buy it in bulk, may cost $4 or $5 each. And imagine the Carl Ushta where you have 200, 250 people a day working. That are 200 by $5, that are $1,000 a day for just the mask. And when at one time you blow $30,000 just for a mask. So it does, but it's worth the while. And I think that for us healthcare workers, we should demand at least that we have the N95 mask available to the healthcare workers. people might feel comfortable using surgical masks, and of course the general public could use just for the out in public the cloth mask, no?
Yeah. With layers, because it can't just be one layer.
With layers. Yeah. And use it properly, no? I mean, you see the occasional people when they drive out, they still got it on the chin and on the forehead and then kind of thing. But I still people feel like people got sense. You got one or two wanderers in the street where you know that they have mental illnesses that do not wear it properly. But 95% of people know exactly what they should do. And they should get flagged if they find not to use it properly.
All right.
Not that way just coming.
So definitely keep up with the mask use. What about the conversation about taking your interaction time outdoors? I know that one of the things that we keep on hearing is try to avoid enclosed spaces with recirculated air, like the air conditioners that we're used to. For people who do have the option of maybe using outdoor spaces, what is the thought there in terms of science?
Definitely go for the outdoor spaces, Marlene. Definitely, as much as possible, be outdoor. Try to avoid enclosed areas. And if you do have enclosed areas, you can avoid it anyway. Make sure that the air circulation is proper. Practice that 6. I know a lot of, for example, workplaces where we have multiple people on the floor. Make sure that we are 6 feet apart. Make sure that the companies as almost could invest into figure how they could circulate the air in their office better. But wherever it is possible, in the restaurants, for example, try to do outdoor, or try to just use the pickup services or the delivery services and avoid enclosed areas as much as possible.
All right. Any other tips or advice that you have for the wider public?
Again, just like we started, Marlene, just everybody should have the understanding that everybody that believes have the COVID virus. Behave like that. Use your mask, wash your hands. If you want to walk around with one face shield, then so be it. That are your prerogative, that are even another layer of protection. And we have to also look at things like the public transportation, make sure that we not say one thing and then do something else, as in terms of telling people they can't get together, but yet still allow the buses to have overcrowding and people standing up and so forth. And we got sensible people in the government, and they must go figure out a way how to solve this public transportation issue. They're not rocket science. Yeah. Take one, leave it and get together and work along with the bus people themselves, work along with the commuters, work along with the employers. Like, for example, make some people go home 4 o'clock, make some people go home 5 o'clock, so that not everybody want to use the bus at the same time.
True.
There are a lot of ways that this can be done. Lad, man, come on.
True. All right. Well, we appreciate you having this conversation with us as we update ourselves once again on the latest science on COVID-19. Thank you very much.
And I must say, Marlene, generally the media overall, yourselves, Creme, Love FM, they have been on top of it. They haven't gotten the COVID fatigue too much. They're still bringing to the forefront every day, every week, the whole issue with COVID, which is good. No?
All right. Thank you. And with that, we're going to go ahead and take a break. And from talking about COVID to how the pandemic has changed our lives, we saw that most clearly with our September celebrations. And we're going to talk about that a bit after the break. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.